All right, welcome back to Honestly. I'm Chris Lee, MD, and I do Morpheus on my face.
Hello, I'm Jenna Gomez, and I've gotten breast implants.
So, last episode, I went through the anatomy and what gynecomastia actually is, why the gym isn't fixing it for a lot of men, and what the procedure really involves, including some options most guys don't even know about, like fat grafting to the upper chest, BodyTite, and Morpheus for the skin, and what we do for guys dealing with significant skin laxity after major weight loss. Today, Jen and I want to get into that part that doesn't fit the scripted episode, what it actually sounds like when men finally bring this up, and what happens on the other side of the conversation. So
Cool.
let's get into it. So we know that the aesthetic or men's aesthetic stigma is dropping broadly in the past couple of years. How is it that you feel that in sort of our lives, and who's still the most reluctant to walk in?
I actually don't know the answer to
No, well, I'll start then.
that. Okay. Who's reluctant?
Yeah. Obviously, I've been in practice for the past almost 4 years, and I do think that my practice has built up men over time.
Definitely.
We were not known as a male-centric practice for male aesthetics. And I think coming in, I wanted to build that some more because I do feel like broadly there is a lot of desire from male patients to have surgery. And I think it's important to make a safe space for that. I do think that is the biggest thing that I've seen is different is that men attach male plastic surgery to specific places.
Correct.
It's like I have to go to this place because
Correct. Yeah.
that is the place. So I think that's the biggest difference that I see in the male hesitancy. Yeah.
Yeah.
When men call you, are they?
Men are very specific about what they want.
Yeah.
They're like, I need breast surgery, or I have extra breast tissue,
Yeah.
and I need it removed. They call it, like you said, very specifically.
Yeah.
They know what they want.
Yeah, I think some of the younger men that we work with, or I've definitely met with older teenagers who are probably the ones that are probably the most reluctant as far as a group. Not to suggest most of them, I'm saying wait
Yeah.
until later, but they have a problem that they don't feel comfortable talking about.
Right. Or saying they need breast surgery.
Yeah.
Or like we can't work it out.
Yeah.
I can do some push-ups maybe. I don't know.
Yeah. So I do think there is still a stigma around it. I think
Oh, definitely.
I think connected to social media and masculinity in general. We've all been in high school. We were all in middle school once. Hopefully things have changed, but I imagine they have not changed as much as I would hope.
No. And it's also, I think, too, been okay for men to just be a little overweight or to have the extra, man boobs. It's kind of been just okay for men, I feel like.
Yeah. I think that
maybe not with themselves, but like the world has been like, oh, you're fine.
I do think for a long time people pushed it aside, but there's becoming this more idealized image of men in the past 10 years or so. That's certainly supercharged the male aesthetic realm. People like Clavicular and others and fitness influencers, and there's countless people who are influencers who are pushing sort of ideologies and a lot of times unsafe practices that I think have gotten more in the spotlight as of late that will continue to push plastic surgery as well as a means to get to that end. But, I agree. I think most of the men that we take care of, most of the adult men that we take care of they're like, I have this problem.
Yeah.
I just want it taken care of, and can I never see you again?
Right, right. Can I never come back for a checkup? No pictures.
I'm never ever. Yeah, I will never talk about this with you, my girlfriend, or anyone else.
No,
but I want this done now and yesterday. Right. I don't want to be healed by yesterday.
Yeah, right. Exactly.
So I think that's what I get the most, and I think, of course, there is a connection with masculinity in some way. The man boob.
Yeah.
Sort of persona or tag that people get, being unfit. I think there is some stigma that's not fair
at all. I mean, it's like women, there are certain areas on women's bodies that there's no matter, like, you can't just work out and get rid of that. I think that's the same issue for men.
And men talk about it differently too. You know, they're not like women that are a little bit more, I don't know if comfortable is the right word, but know the right words to use.
Right.
Men, I kind of have to tease it out of them a little bit more.
Yeah.
I have to be like,
so what bothers you?
Yeah, what really bothers you? And usually they're like, well, I just can't take my shirt off.
Yeah.
I can't take my shirt off.
Or they're constantly having to like fluff it out.
Yep. I can't find any shirt that fits. It's not just, you know, being on the beach. It's everyday life. They can't find the right clothing. It's the smallest amount.
Yeah.
That will bother a lot of men.
Yeah.
Too. So it really runs a real gamut. And I would say that I probably see the smaller amount male gynecomastia more often than I see the major gynecomastia, like the type 2s and 3s where you have a full handful of tissue to take off. But
we've seen a couple.
We've seen a couple of those as well. As far as, you know, in that sense, I do think things have changed in the time that I'm here in our practice. Has that been different throughout the country? I don't really think that is necessary. I mean, obviously, it is becoming more prevalent. So yes, male plus is growing. I think a lot of clinics are kind of geared towards like, if they take care of men, that's where I want to go. I do not want to go to where any women are taken care of. I don't know if that's like, I don't want to be seen in that situation or I don't want to be associated with it, but
I think men, at least when they come into the consult, it is a little like when you have a woman, you know, taking off your shirt, you know, and I have to take the pictures, you know, they kind of stand up a little bit taller and try to flex a little bit. So it's probably, you know, I don't know.
Yeah.
What is the word?
Emasculating.
Emasculating.
Yeah. We went to college.
Yeah. Chops first.
There we go.
Mom's proud.
When men call in, do you find that there is some emotional texture to that call? How do you feel they sound and they act during the call and during the consult?
I think most of them are, if they're calling for this, they do sound, you know, more confident because, you know, this is what they want. But it's like we said, it's more of a lifestyle for them. It's, you know, like I'm working out so much and I just can't get I just don't look right in shirts, or I was a bodybuilder and I'm, you know, maybe I'm old. Well, I'm older now and I just, this flesh or this extra stuff, I just don't know what to do with it. So I'm getting two sides. They're either like, you know, kind of tiptoeing around it a little bit and a little shy, or they're like, this is what I need. I want to come in for gynecomastia.
Yeah, I would agree with that. I feel like either someone comes in and they're just like, I can't fix this and I know you can.
Yeah.
So please take care of it.
Yeah.
And then there are the more shy sort of, you know, I've been thinking about this. This has bothered me since I was in high school.
Yeah.
I haven't been able to do anything about it. And yeah, I think there's a lot of emotional baggage that they don't talk about.
Yeah.
And they don't really bring up because we're men.
Right.
And
you guys have to be so macho. And
yeah. And we don't like to talk about our feelings.
Yeah. I mean, it's more say like I need breast surgery. It sounds more like a woman thing.
Yeah. So
I get you.
It's understandable, but you know, guys, you can cry.
Yeah.
With us.
It's actually more manly.
Yeah. This is what a real man does.
A real man.
Are you a real man? What do you think surprises men the most when they actually come in for a consult?
Well, one, they have to get undressed in front of a woman. What else surprises them? I don't know. They do like, men, you guys do like a really good job masking it. I don't really, I mean,
they don't act surprised.
No, they don't act surprised. I guess they don't know, they don't understand what exactly, like the anatomy, what has to be taken out, like the glands, or what has to be taken, like they don't understand the procedure.
I think I would agree. I think the process of actually fixing the problem is the biggest surprise to them.
Yeah.
They know what it is. They know what they want gone.
Yeah.
But they have no idea
what
that actually entails or what recovery is like, or you know, I would do liposuction, or that there's a piece of gland to take out.
Right. Or also the incision lines.
Yeah.
They're, you know, they don't want that.
Right. Yeah.
So
I mean, certainly, and I get it. If you have a lot of skin, excess skin, as we talked about, there's a chance that we have to take away some of that excess skin. And one of those lines is the dual horizontal incisions right underneath the chest fold. I try to design that to fall into that plane or that shadow line of the pec. But even with that, it can give a very, you know, the trans male stigmata, which cisgendered males tend to have a hard time with sometimes.
Yeah.
But the reality is, as I say to everyone, and as we've said before, a well-placed scar is going to be better than bad shape.
And also, men, you probably have hair in your chest.
Yeah.
So you can just, it'll hide under there, all the fluff.
Unless you're me, and then you have very little hair. Have you ever had someone call in who's clearly just relieved to say the words out loud to someone? Like they finally got it off their chest.
Hey, see what you did there.
Yeah, like they feel this sense of relief. Do you feel like you've ever had that?
Like once they call?
Yeah.
Kind of, yeah. And then also I find that if I'm like, oh my gosh, yeah, this is something we repeatedly do, which it is, if they feel like they're not alone in this, it's kind of like a whew. And then once we get you guys in the door and we talk to you and you're not alone. But yeah, it does seem to be like, whoo, I finally got this off my chest.
Yeah.
Like
I think along those lines, there are some men who are really closed off and cagey about all this stuff. There are some people I have to coax the information out of them. A lot of men won't tell me everything about what hormones they've been on, if they've been on anabolic steroids. I really have to ask that question if they're on any other medications, because there's lots of medications that can cause gynecomastia or make it worse.
So I didn't know that.
Yeah, there's a whole slew of medications that can increase your chances or the amount of breast tissue that someone has.
Oh, wow.
So anything that can
like what
change, well, obviously testosterone. You would think that testosterone,
so it makes you, wow.
It can. Not always, but it can, because it can change the balance as testosterone is converted into estrogen. If you're taking a lot of testosterone, you could be making more estrogen. So that's when anabolic steroids come into play. So if you're really juicing, you can flip the switch and add the amount of estrogen that's happening in your body. Some people will take things like an anastrozole to block that, but it doesn't always work. Spironolactone, finasteride, common hair treatments. There's a whole slew of medications.
Wow. So, okay. Good to know.
So, yeah.
Okay. So for the GLP-1 male patient, what's the presentation like in the practice? How is it different from the classic gynecomastia consult?
Yeah. So GLP-1 patients tend to be massive weight loss patients. If they are on the older side and their skin has been stretched a lot, they tend to be the ones that might need some skin resection.
Yeah.
So that is the biggest thing to know about before coming in, just to prepare yourself for the possibility that you may need some skin removed.
Yeah. And it's kind of like you have to think like what bothers you more. Yeah. Like we say, like, would you rather have all this excess skin or a little incision?
Yeah. Essentially, if you're coming into me and you already have some skin that's overhanging sort of that chest fold, then you should be aware that the likelihood that you have some skin excision is high.
Yeah. We've got things for that too, so don't be scared.
And there are sometimes that we can sort of do our best to use energy-based devices and move skin around on your chest, but in general, the best look is to just cut the skin out, if that's the case.
Yeah.
Yeah.
Okay, and what about like steroids?
So
when people, how do you bring that up without them feeling embarrassed?
The steroid conversation is a just blunt conversation that I feel like I need to have, and it's not something that I tiptoe around. I just,
flat out ask
it, because I think that if you tiptoe around it, it makes it feel more awkward.
Right.
And it's better to know what's happening before going in than, find out when it's too late. So you really want to correct all the possible things you can correct before doing the surgery to get you where you need to be. And if someone needs to be on testosterone, that's totally fine, but we got to figure out other ways to combat that.
Yeah. So what about this? Have you ever had a patient that's waited like 10, 15 years to get this done?
Yeah. So definitely.
Yeah.
I'm always telling patients, even this affects a lot of youth. A lot of teenagers going through puberty will have hormone imbalances. We've all had acne. We've all had body changes. Some of those body changes, about 50% of men will have gynecomastia at some point in their life.
The procedure?
Nope. We'll just have have the physical manifestations of gynecomastia.
50%?
Yeah, 50%. So
wow.
It's very common. And
guys, you're not alone.
You're not alone. And a lot of that is in pubertal males who are going through their puberty. And most of that will resolve on its own. But then there's a lot of people who have just had it since they were kids, thought that this is their life, and didn't think that there was anything that they could do about it. And eventually, they hear something on TikTok, they hear this podcast, and then they finally like, I'm going to do something about it.
Yeah.
So, yeah, absolutely.
So tell me about what are other options if, to like kind of mask the gynecomastia? Can you do like fat transfer to the chest or?
Yeah. So I think the biggest difference that we have from other clinics around this area is that we use a lot of fat grafting for a lot of different things, for augmentation, but also to help with contour, facial fat grafting, and muscle fat grafting to certain muscle groups to help emphasize the size of the muscle and to augment the size of the muscle. That can help a lot, especially if you are in sort of that borderline case with that little excess skin.
Yeah.
Because what it does is repositions your fat in sort of a feminine area, which is that lower chest, and puts it in their upper pec so that they look more jacked than they do feminine.
Yeah.
And I think that's a huge benefit when you're doing a little bit of liposuction. Just repositioning that fat in the right spot can make a big difference.
Yeah, that's awesome.
Yeah.
Sweet.
Now, we get almost everyone that we get, we're not their first stop in trying to fix this stuff. Everyone has tried something before.
Oh, definitely.
And, there's so many influencers, so many trainers out there that are just like, you just got to lose the weight.
Right. Do some push-ups.
Do some push-ups. Bench press more. But a lot of people still aren't where they want to be. And that's because of what we talked about before. That gland is not something that you can just metabolize off.
No.
It's hormonal, but it's not going to change because you are jacked. And sometimes it can look almost worse if you're extra jacked, because then you have this big muscle and then this cone of breast tissue that almost pokes out more.
Yeah.
So we get a lot of bodybuilders and things like that, or people in that genre demographic who have this problem and want to do something about it.
And you're like, that's awesome that you do.
Yeah. Yeah.
Very manly.
So manly. And all I say to those people who have been told sort of over and over again that they're doing something wrong by people on Reddit or people on TikTok is, listen, this isn't your fault. This is your body.
Right.
And while there's nothing wrong with your body, it is your body.
Yeah.
And everybody is different. So I think coming to terms with that might be difficult, but if it's something that's making you unhappy and self-conscious, then
yeah, talk about it.
Yeah, fuck what the influencers say.
Fuck that shit. So how do you know if you need gynecomastia versus just a little bit of lipo? Yeah,
that's a good question. So if you have very soft tissue that you can really sort of that's squishy in the chest, that's probably most likely fat. What gynecomastia is, the true gynecomastia, not pseudogynecomastia, which is fat, is that firm bit of tissue right behind the areola that you can feel. It usually feels like a disc. You'll be able to palpate it. Everyone has a little bit.
Like the woman that have the pushed out nipple? I think?
It is the same tissue. It's not tuberous breast.
Oh, okay.
But it is the same, and men can have tuberous breast too, but it is the same as breast tissue in women.
Ah.
So it'll feel firm. It'll feel like a disc. It'll feel almost like a mass behind the areola. If you're testing on yourself what may need to be done for you, that's one way to look at it, because that's how I look for it. So
yeah. Okay. And then how do you know? So liposuction, obviously there's no scar. There's just a little holes, but gynecomastia, you'll have a...
Yeah. So gynecomastia, I'm always trying to do this with as few scars as possible. Most of the men that come to see me, unless they're the GLP-1 patients, tend to have the amount of gynecomastia that I can usually correct with just a very small incision, either at the areola or at the base of their nipple. No one will ever be able to tell it's there. No one will ever see it. I typically try and use fat grafting and different energy devices like BodyTite and Morpheus to help shrink any of that tissue, because that is one of the biggest reasons that I do any revisions, is for a little excess tissue that just doesn't quite shrink.
Because maybe you take out too much. Like if you took out too much.
It's even if you take out, if you take out too much, you can cause something called saucer deformity, which is like a concave nipple, which is
tricky. You have to take out the right amount.
But if you take out too little, you're still going to have some left. So, while this is a very high satisfactory procedure, there are things that can go aesthetically wrong that obviously can be fixed, but obviously you always want to try and get it right the first time.
Right. Okay, and what about in terms of working out? When can you get back at it?
So, like any liposuction procedure, I usually tell people about 5 weeks is around the time, 4 to 6 weeks is around the time where you're back full time at the gym.
And what happens if you go earlier? Like 2 weeks
if you go earlier, the biggest issue is that you're going to swell. Okay. And swelling is going to cause, could cause poor healing. It's unlikely that you're going to hurt anything, but you just want to let your body sort of relax. You could get seromas, you could get things like that. Okay. So I think it's best to just let everything, especially in those cases where you have to do a lot of undermining to move that skin around. Mm-hmm. You really want that tissue, that skin, to heal back down in place where you want it. Yeah. As opposed to, all bunched up in one space. So whether you get gynecomastia or just liposuction, 5 weeks. Yes. Pretty much. Yeah. Okay. Yeah, generally. Cool. I will say, if you do have that pseudogynecomastia, that's softer chest, there is a chance that weight loss alone could make a difference. So we have something for that too. You can always start with that. So, quick honest take. What would you say to a man who's been living with this for years and has never told anyone that it bothers him? What would you say? I would tell them that you're not alone, because we all, women included, have something that we don't like to talk about, but we notice all the time. And nobody does have to know about it. We can, obviously HIPAA, but you can just come on in. Let's have a conversation about it. We'll give you the information that you need. And if you want to move forward, you can take, all the time that you need. But if it is something that's bothering you, we get that and we want to help. So if however we can get you over the finish line, we're here for you. Yeah. I would say it's your body. It's not your fault. There are ways to improve that part of your body, and let us help you. Yeah. That's really it. Don't take this as a failure. This is just how your body developed. And there's nothing wrong with wanting to, enhance what you already have. Yeah. And there's nothing really to be ashamed of. At all. I know that a lot of men are, but there really is nothing. And a conversation is just a conversation. Yeah, absolutely. Cool. Mm-hmm. All right. Cool. Well, thank you for joining us for this conversation about gynecomastia. This has been a great episode of Honestly. Make sure to check us out on YouTube, Spotify, and Apple Podcasts, and our Instagram, or Honestly Pod, as well as TikTok. On the podcast, we are Honestly. We'd love to hear from you. Any questions, comments, send them to our DMs. Rate the show. Yeah. Tell us how much you love us. Yes. That one listener. And then specifically what you love. Yes, you know what I'm saying? If it's just Jenna, I will be okay. Right. I will get by. But yeah. Awesome. Thanks for coming. See you out there.